Hey, welcome to another edition of the Nonprofit Leadership Studio. Another great guest this evening. We have Elena Marks with us. Elena is the head of the Episcopal Health Foundation, one of the largest groups in the state of Texas funding health and nonprofit groups. And so, Elena, thanks for being here with us.
Thanks for inviting me.
Yeah. So, Elena, one of the first questions that I'll often ask people is if you're writing a book on philanthropy or fundraising, from your perspective at the foundation, what are some of the chapters about?
From the fundraiser's perspective?
From your perspective.
From my perspective about fundraisers.
Yeah.
Well, I'll tell you something that we have been dealing with that's a challenge and that I would like to inform nonprofits about, and that is how they use development staff. We prefer to have conversations with the program staff and not with development staff. And many foundations prefer to do it differently, but the reason that we do want to have conversations with the actual program staff or leadership of the organization as opposed to the development staff is because we work in a fairly prescribed field. It's community health, public health. We have people on our staff who, by education and training and work experience, this is what they do and this is what they know. And when we're talking to a potential grantee about what it is that they're interested in doing, we want to talk to the people who actually do the work. And the development directors are often trying to interpret. They have really important work to do and they're good at putting a grant in order, but we really want to talk to the people who are doing the work. And that's been a challenge in some organizations who are accustomed to having the only liaison with a foundation being the development people. And we have tried gently to let organizations know that's great if your development person comes along, but we really don't want to have the conversation with that person. We want to talk to the people who are doing the work.
You already feel good enough about yourself. You don't need the development person saying what a great job you're doing all the time. So.
Well, there is that. There is that.
You know, this morning I was talking with Jeremy Smith, who is at the Rainwater Foundation. I don't know if you know Jeremy.
I don't.
But he was talking about this specific thing. So he's the head of the foundation. And he talked about how a lot of times when you deal with development people or fundraisers, it seems more transactional as opposed to when you're dealing with the people that do the work, you could actually be a thought partner.
That's a really good way to describe it. The development officer's job is to bring in money, period. And our job is in part to give away money, but it is to give away money with an end in sight. We have our own goals and strategies, and when we are funding an organization, we're funding them because the work they do achieves our goals and strategies. And so we want to have a conversation with them about that and not about how much money do you need to do what you're doing.
Yeah. Tell me about Episcopal and what you guys do, and because you're relatively new.
We are less than 3 years old, even on paper. So we are the product of the sale of the St. Luke's Episcopal Health System. St. Luke's still in the medical center, now owned by Catholic Health Initiatives, which is a national organization headquartered in Denver with, I don't know, maybe 100 hospitals to it. So the Episcopal Diocese started St. Luke's Episcopal Hospital in the 1950s at a point in time when if you wanted to have a health ministry, what you did was build a hospital system. That was the latest, greatest, brand newest thing to do if you were trying to promote health. And so the diocese built the system over decades and decades. And in the early 2000s, and by about 2010, when they were deciding what the next chapter of their life was going to look like, all the changes going on in the healthcare delivery system, and actually more importantly than that, an understanding over the last 20 years or so that the real determinants of health are largely outside of the medical center and are really in the community and in the environment, led the diocese to believe that if they really wanted to improve community health, they'd be better off monetizing the hospital system and taking the resources they'd gained from that and using it to work over the 57 counties that have 10 million people in it, which an acute care hospital just can't do as well.
And how much money do you guys aim to give away every year or to fund?
Well, it's going up year after year.
Yeah.
So we started out in our first year of real giving, which was last year, and we gave away about $11.5 million in competitive grants. And this year it'll be about $16 or $17 million. And we're expecting to go up. And we have a real advantage that some brand new foundations don't have, and that's that we are designated by the IRS not as a private foundation, but as a supporting organization of the diocese. And what that means is that we have not been forced to pay out 5% of our corpus every year. And the reason it's a really good thing for us, and would be a good thing for any new foundation, is it takes you a while to figure out what it is you want to invest in and how you ought to be investing in it. And our board from the beginning very wisely said, we're going to ramp up the grant making over time as we get more clarity of mission and purpose, and as we frankly just get better at doing our jobs. And so this year we have gone up by about 60 or 70% compared to last year. We'll jump up again next year, and the hope is that over time our grant making will be in the $30 to $40 million range every year.
Wow. And when your board and your staff get together and you sort of come up with sort of your worldview of what is it that you want to see happen, what sort of discussions happen around that?
Well, it's interesting because they've changed. So when we started, the first, so I get hired, the board basically says, so we have all this money, and we have this mission of improving the health and well-being of these 10 million people. What do we do? How do we do that? Which was like the best question anyone ever asked me. And so we went through a very deliberate planning process with the board where we started talking about everything you could possibly conceive of in terms of health, the broadest definition. And we talked about the different ways you might look at it. Do you want to look at diseases? Do you want to look at different populations? Do you want to look at different kinds of services? Do you want to look at different levels of care? Do you want to look outside of the medical system at all? And we worked through a process that really led to our deciding that our mission really was about community health. And I have a public health background, not a medical background. And so I operate from a population health perspective and not from a medical perspective. And most of our staff has that kind of an orientation and focus as well. We have people who have policy and public health backgrounds as opposed to medical backgrounds. And so it was easy for us to be able to talk to the board about the opportunities in community-based health. And so we decided our overarching vision is healthy communities for all, which sounds simple and apple pie and all of that. But we have a specific definition of what a healthy community looks like. And it has to do not only with the physical and mental health of the people who are living there, but about the social health, and is there social cohesion in the community, and do people really have a safe place to live, play, work, and pray, and go to school? And really, how do you look at that from a big picture perspective? And our focus is on the most vulnerable populations because they need help in the ways that populations with resources or access to power don't need that kind of help.
I want to ask you about your background. So did you grow up in Houston yourself?
No, I grew up in Atlanta.
Wow. And where did you go to college then, Elena?
So I went to college at Emory in Atlanta and went to law school. I ended up in Texas because I went to law school at UT in Austin and never in a million years intended to stay in Texas. And anyway, ended up staying in Texas. And I practiced law for a number of years. And not health law, nothing related to this. I was a trial lawyer and did largely business litigation. And stopped doing that. I started a business, a for-profit legal search firm business, did that for a while. I sold that business. It ultimately went public. And I stayed home with kids for a number of years. I've got 3 kids. And I got bored with that after a while. And and actually part of the time while I was staying home with kids, I was doing pro bono legal work for Planned Parenthood.
Oh, okay.
And so I had some insight into the healthcare world and the world of trying to help people in preventive health who were in low-income families, and particularly around women's health, which is an interest of mine. And so, people think about Planned Parenthood and they go straight to abortion wars and all that, but Planned Parenthood is a
So much bigger than
very large basic provider of women's health services, primary care, and the kinds of issues they deal with are common to any other organization that deals with low-income populations who are trying to be healthy and work on preventive community-based care. And so I got a taste of it from the work at Planned Parenthood, and I was getting ready to go back to work or to do something. I was not going to practice law again, and I had a friend on the faculty at the UT School of Public Health, and she said, well, why don't you go get an MPH? And I thought,
why not?
okay, I like school, I like to learn.
Yeah.
I know something, this much about this. All right, I'll go do that. And so when you apply to the School of Public Health and you have to say, what is it you want to do? What are you interested in? And so what I said was that I was interested in who has access to care, who pays for it, and who decides. And those are questions I'm still interested in today.
When you went to the School of Public Health, were you one of the more experienced people, sort of in terms of sort of work history?
Do you mean old?
I'm trying to be very delicate.
I was. I mean, I went back to school in my late 30s.
Yeah.
And most students were younger than that, although there were a lot. The School of Public Health has people who come back in at all different points in their careers. And so in that sense, it was really enriching because there were people who had done so many different things. But for me, it was a complete, I didn't necessarily think I was getting a career out of it. The way I wound up actually turning a lark into a job was my randomly assigned advisor happened to be the chief strategy officer at St. Luke's at the time, and I took his classes, and he's basically a finance and strategy guy. And as I was near the end, he said, what are you going to do when you finish? I said, I don't know. He said, why don't you come do some work for me? I said,
wow.
All right, I'll go do that. So I ended up doing some work at St. Luke's.
How long were you there at St. Luke's?
I don't know, 3 or 4 years maybe, doing all different kinds of things, a lot of program planning, evaluation. I did some grant writing for them. I helped them get funding to create a Center for Integrative Medicine, and was enjoying my work there.
And how long before you then became sort of advisor to Mayor Bill White?
Well, that was also an unplanned event.
Yeah.
So he is an old friend of mine.
Yeah.
He and my husband were law partners, and when he was running for mayor, I went to volunteer on his campaign just for fun. I liked him. I mean, I didn't, I had not worked in a political campaign before, and I did a lot of policy work for him. I ran his books. So I was doing that, and I had taken, toward the end of the race, I had taken a break from St. Luke's because I had landed a 7-figure grant from a local foundation that was going to come in the next January. And so I thought, okay, so I'll take a break from Luke's. I'll go play at the campaign because it's fun and different, and I think I'm being useful. And then when that money comes in, I'll go back and I'll build this center and go back to business. And then when Bill won, which was not a surprise to me, but I was thinking I'm going back, he and I sat down in mid-December and we cooked up a job for me. He has had a long-standing interest in access to care and vulnerable populations, and basically said the city is not directly in the healthcare delivery business, but we are in the public health business, and I have a big bully pulpit. And basically he created a position that allowed me to use the power of his office to move things in the community around access to care.
And jump forward to 3 years ago when you took this job with Episcopal, in terms of sort of this startup, if you will. Did you seek it out, or did someone just say, "Hey, you seem to be like the perfect person"?
I knew the job was out there. So what I did in between the city and Episcopal was some consulting, and then I'm a health policy fellow at Rice, which I started in 2010 right after I left the city. And so that's what I was doing and really enjoying it. And I'm a policy wonk at heart.
Yeah.
And that's what I really like. And I knew about this job, but it never occurred to me to apply for the job. And the way I ended up in the job is truly by happenstance. The board chair and Mayor Bill were, they knew each other from business or whatever. They happened to be having lunch together one day, and she was saying, "Oh, I'm heading this new foundation and we're doing a search for a CEO." And Bill said, "I know you have to hire."
Wow.
And so
It pays to have nice friends.
and it pays to have nice friends who have lunch with other people, apparently. And so anyway, they had a search firm and a search process and all of that. So I said, okay, sure, I'll talk to her. And not thinking very seriously about it. I wasn't sure I was a fit for it. I was happy in what I was doing. I was not looking for a job. I had specifically turned down other recruitment attempts. But I met with Lynette Diley, who is still my board chair, and then met with the search committee and sort of thought, wow, maybe this is the right fit for me, and luckiest day of my life.
Yeah. When you look, I'll switch tact a little bit. When you look at the many organizations that apply for funds, and I'm going to guess most nonprofits that do anything with health have probably come to you or will come to you at some point, right? And when you look and sort of compare them, are there some that you think, well, these are very high performers, and these there's a lot of reasons to like these? I mean, who are some of the high-performing organizations that you really like? Or is that an unfair question for you right now?
I think that's an unfair question. I mean, I can talk generally
Talk
about
about
it, but I don't
what are
want
the
to
sort of the
name
characteristics
names.
that you really look for when you really want to be a partner with an organization?
So first, it's that what they are doing is aligned with our goals and objectives. There are a lot of fantastic organizations out there that are very effective at what they do, but it's not what we do. And so the first thing we look at is whether or not the work of the organization and the organization itself is aligned with us. Once we've made that decision, then we look at what it is they're asking us for and whether or not we think they can deliver it, are the people to deliver it. We look at their financial statements, and we have a banker, an ex-banker on our staff who will analyze the financials, and we will ask a lot of questions. We talk a lot with other funders. Because others who have funded organizations have opinions about them. And it's not that all of us are moving in lockstep, but we do talk to our counterparts and see what their experience has been. One of the things that we have learned, so we fund broadly in 57 counties. And so once we are out of the greater Houston area and out of the Austin areas, when we're in the smaller towns and particularly in the rural areas, there is very often an absence of anybody who can do the kind of work we want done. And often, to the extent anyone's there, they are running on a shoestring, and they don't have the characteristics of a high-functioning nonprofit. And so we have been making a lot of investment in capacity building and finding organizations that we think have something really good about them, and basically saying, we want to build you. There's a small organization that we think does incredible work and hasn't been able to land a lot of funding, and I don't know how hard they've tried, and we tripled their budget because we did enough due diligence to understand that they can do this, that they are doing what they're doing, which is fairly unique, and nobody else anywhere near is doing it. And it was worth the investment to us. So once we're outside of Houston, we really are challenged to create the capacity in organizations to do the work, including in some cases creating organizations, finding somebody and basically saying, put a nonprofit together.
Have you done that?
Yeah.
Yeah.
Yeah. We'll you can't write it, we'll write it for you. Here's what to ask us for. Because we're not in the direct service business. We don't want to start an organization ourselves and offer any kind of services. We want to find partners who are locally based and good at what they do, and we want to give them money to do what we would do if we were operating.
Wow. So you look at their mission, you look at sort of what they're doing, you look at the leadership, you look at the board. Are all those things that are equally important?
Yes, the leadership is really important to us. There's a lot of weak leadership in nonprofits, and there's a particular concern we have about board leadership in nonprofits. There are boards who are disengaged or who are committed to the program but are not fully informed or engaged around the operations of an organization, and it's alarming sometimes because some of these board members are people who are very high functioning in successful businesses, but somehow they get in the nonprofit world and it's like, it doesn't matter, we're just so good because we're helping poor people, and that's not good enough.
How do you figure that out? Because I think you're exactly right. You see this all the time.
So we haven't fully figured out how to figure that out. We ask a lot of questions, but you don't always know. So one of the things, we will be posting this week a position for a capacity building officer. And what we want that person to do is look at all of our grantees and potential grantees and help us come up with organizational assessments so that we can figure that stuff out, and not so that we can punish people, but so that we can help those organizations that want to be helped. We provide a lot of just general operating support. We are not one of those foundations who says, oh my goodness, you have overhead. How can you have overhead? We think you have to have overhead. We think that if you are going to run a competent, high-functioning nonprofit, you have to do all of the things a for-profit business does except return money to investors. And there's no excuse for a nonprofit organization not to have good finance systems and IT systems and other systems in place, and we shouldn't expect nonprofits not to pay people fairly. You miss an opportunity for a huge sector of people who could do really good work, but they're going elsewhere because you're not paying them well. And it's unfortunate and it's demeaning, and it also says something about what you think about the clients you're serving if it's okay to do it on the cheap. Wow.
Let me ask you a different sort of question. We see a lot in a lot of fields the idea of Uberization or disruptive technology. Do you ever see that happening in philanthropy, or certainly it's happening in health in many ways, but do you see it happening with what you're doing?
So we're new to philanthropy, and we have gotten into this world at a point in time when a lot of people from government to the general public are sort of looking at philanthropy and saying, wow, who are you even accountable to, and what is it exactly that you are doing other than like writing checks, and is it actually making a difference? And so there's a big movement within philanthropy around accountability and demonstration of impact. And so we have come on board as that is causing many foundations to change the way they've been thinking about what they're doing. And so it's not that we're any better than anybody else, it's that we don't have that baggage. So we're not turning a big ship. So we come into the world and we understand that evaluation is critical. And so one of our first hires is an evaluation officer. And so you're seeing that movement in a lot of organizations. One of the most interesting comments I ever heard from a panel of CEOs of some really large national foundations when they were asked, what is the one thing we ought to be asking ourselves? And so what one of them said is, are we ever able to demonstrate, and I would put this to you as running a nonprofit as well, that we are making people any better off than if we just gave them the money?
Right? That's sort of an
because so much of what we are trying to address is tied to or rooted in poverty. And so if we just gave people the money, would that do a better job?
That gets back to what you and I were talking about earlier, is this idea that so many foundations and so many nonprofits want to serve what is needed right now, right?
Right.
And that's a good point, where sometimes just the money would be maybe better to take care of these people. But I think one of the things that Episcopal is doing that's maybe a little bit different is this whole idea of systems change, right?
Right, and it's a luxury that we have because we have a lot of money and we're here forever. So we are playing a very long game, and we have made the intentional, conscious decision to forego solving some current problems in favor of spending resources that won't pay off for 5 or 10 or 20 years.
Mm-hmm. Wow. Let me ask you, and maybe it's a little bit political, but this idea we hear many times about how we have the greatest healthcare system in the world. When you look at the Texas Medical Center, it's the greatest in the world. Yet when we look at the data, of course, there's a huge part of our population that isn't taken care of, and we have high infant mortality and so many problems that we could point to. How do we ever get past that whole idea that we're the greatest in the world, yet we're not the greatest in the world?
I think we're having that conversation for the first time, and the only reason we're having it is because we have gotten to the point where people and businesses don't want to pay any more for health care, and so that has forced people to say, and what are we getting for it anyway? And so I am so happily intrigued that I'm in so many conversations now with people who are not from the healthcare world, but from the business or civic world, who are saying, we pay more than any other country, exactly what you just said. And so that has opened the door for the conversation about what are we paying for and what are we getting for it. And the data points that I use over and over now comes from some work that the Commonwealth Fund, which is a foundation, has been publishing, but it compares developed countries in terms of the percentage of GDP that they spend on health care and the percentage that they spend on social care, and what is the relationship between the two. And if you chart that against data points like infant mortality rates and even lifetime expectancy rates, you see that those countries that are spending the most on social care have the better outcomes there. And you look at us, we have the worst outcomes in most categories, and we are spending much more than anybody else on health care and much less on social care. And we're starting to see the conversation in this country now switch from spending more money on more health care and looking at cheaper ways to get better results.
Yeah, it's almost like we don't want to admit that there might be a country that's doing it better than, we really don't want to look at Sweden, and we don't want to look at what's happening in France, because we're America, darn it, and it's got to be better here.
Well, and we have spent the last 50 years saying more is better, higher cost technology is better. If one MRI is good, 2 is better. And we have we have a culture that thinks that the latest, greatest, newest thing, and as much of it as possible, is what we need. And all of a sudden we're like, well, we can't pay for that. And now we're learning that, in fact, that's bad for us. It's not just expensive, but it's bad for us. But we've built a system. We've been telling people for years, go build a hospital with all this fancy equipment. And in the last few years, we've kind of gone, no, we didn't mean that. No, that's not the way to improve health status. And so we've got, trillions of dollars invested in capital that we are trying to retool, and you can't just do that overnight. And so how we move from funding all of this to funding this instead, and understanding that the total pie that is being funded is going to shrink, needs to shrink, has to shrink. So there are going to be shifts in where the money goes, and there's going to be less money of it. And that's a really hard conversation to have.
Well, I'm being very selfish with your time. A lot of tweets are coming in,
Okay.
so let me ask a couple of questions from the class. Rocio Beisa wants to know, what are some of the traits that, based upon your experience, make a great leader?
Somebody who will talk and listen.
Listening is so important, isn't it?
Yes.
Wow.
Yes, and within nonprofits, one of the things that we're really focused on is whether or not the nonprofits that we work with listen to their own constituents.
Oh, that's important.
And the organizational effectiveness depends on meeting the needs of your clients, even though they may be getting what you're giving without paying full value for it. And you think you're doing them a favor. So I think the listening is really important.
Do you find, having interviewed many leaders here, and I ask about this, women leaders will often talk about the importance of listening, and men hardly ever. I mean, do you notice that? I mean, I notice that they at least talk about it. Men may be great listeners, but they're not at least talking about it.
I don't know, and we are in a very woman-dominated
Yeah.
or oriented sector.
Yeah.
The whole nonprofit sector and the foundation sector as well has many more women than men, and our foundation has many more women in it than men. And in fact, our leadership team is 4 women and 2 men.
Oh, wow. Well, I mean, it's they're better workers, I find. So. Let's see. Maya Bean wants to know, is there an organizational style that you try to model after? Did you see another organization that you wanted to be a model for? Or that modeled for you?
When I started operating this foundation, I had the luxury of being able to invent it however I wanted to accomplish the mission that the board had charged me with. And so I spent a lot of time looking at how other foundations were organized and learned a lot from that, and didn't follow a particular model, but took pieces of models. And we are structured somewhat differently than anybody else, but most of them are structured differently from one another as well. And, we're really in the beginning of year 3 of operation, so the jury is still out on whether we are organized structurally the way we ought to be.
Valerie Garate wants to know, how different will Episcopal the Episcopal Charities Foundation be, Episcopal Health Foundation be 5 years from now than it is right now?
Well, I hope it'll be the same in sort of the values and orientation, but much better at doing the work.
And do you think people will be speaking of it differently, or?
I don't know. I think people are still trying to figure us out, and of course
right.
we're kind of like figuring ourselves out at the same time.
Yeah.
I think we are increasingly bringing clarity to the public about who we are and what we do, because we're developing that ourselves. And I expect in 5 more years we will have much more clarity of purpose, and that we will be focused on a few big things, and that's it.
Jordan Klein wants to know, do you still use your legal background?
All the time.
Yeah?
And not in the sense that I'm practicing law. What I got from law school is sort of a framework for problem solving and analysis that fits with me. It just, I don't know, my brain is organized the way the law is organized, so law school is very convenient for me in that sense. And I use that structure and analysis and those organizing principles over and over and over.
And Mary Ramsey Jones wants to know, can you change things immediately about the organization if you need? If you start working down a particular alley and you want to change, can you do it very quickly since you're relatively new?
Yes.
Yeah.
And that is also a luxury, because I've watched some other foundations locally and nationally who have, every organization periodically has to go through a soul searching and saying, this has been what we've been doing for X number of years. Is this what we're going to do going forward? And they need to refresh, and that's appropriate. And I've watched several of them do that, and you're moving a really big ship, and it takes a while. We still are not that fixed, but every grant we make sort of roots us a little bit more firmly in some piece of ground. And so we are conscious of thinking of our first 3 years as sort of trying a bunch of stuff, building some relationships, and making some decisions based on that work about how to become more focused going forward. So I think we still have the ability to do that, and we have, in fact, after we made our first set of grants last year, as we looked this year, there were a couple that were great organizations doing first-rate work, but that we have said, that really wasn't in our space, and it's not in our space going forward. And so with those organizations, we are having conversations that basically say, our bad, not yours. We don't drop anybody immediately, but this is the direction we're going in, and we'll continue to do that. And I mean, I have a board who is very tolerant of making mistakes as long as you catch them and correct them.
Well, that's good.
It's great. I have a fantastic board.
Because hopefully we're all making mistakes, right? We need to try.
Exactly. And my own bias, and this is, a Bill Whiteism that a lot of people use, is don't let the perfect be the enemy of the good. And so we have gone out and, whether it's in grant making or other kinds of work we have done, and we've done some stuff and finished it and gone, not going to do that again. And I would prefer that than waiting until we're positive it's going to be perfect.
Brian Green from the Houston Food Bank and I will often talk about how invigorating it is when you sort of change course a little bit for the organization, sort of try something new, or move it in a particular direction. Do you find sometimes, as you see organizations, that you wish they would change course, or that they would move a little bit one way? And I mean, I often will see sort of underperforming organizations that I think, well, if you just did something a little bit differently, you'd be better off. Do you see that in your role?
Yes, but I haven't been able to do very much about it. I mean, what we've done now in terms of if someone approaches us and we look at them and go, you really could do something better and we'd like to help you with that, but we haven't been proactive about it. So if it has risen to our attention, then we've dealt with it. That's one of the things I hope this capacity building position will help us do, is identify those organizations that want to get better at what they do. The other thing we want to help organizations do, if they want to, is work more upstream. Look at root causes. And for organizations that are in the direct service business, they are really busy providing whatever the service is, and they are paid to provide whatever the service is. And so a challenge for us is, how do we help you step back from that and look at whether there are root causes that you could be addressing, and how do we help you fund that work?
Lutishi Taylor wants to know, what's the number one reason for denying an organization grant funding?
Well, the easy one is that it's just simply not aligned. I mean, we have a lot of information on our website, and one of the things we say on there is, call us, don't just file an application. I mean, anyone can file an application. When that doesn't happen and they don't read the website, chances are it's not going to be a fit.
And that happens, doesn't it?
That happens
it seems so
all
odd to me.
the time. And we still, and maybe it's because we're still new, we have people pitching us on, well, this does relate to health, which brings the conversation to, yes, it does, it's really good work, it's not our work. And I think that's just going to be a matter of time. So there are a set of applications we're getting.
Do they think sometimes they can argue you into agreeing that?
Sometimes they do, and then some people will try to take it up the ladder. They'll go, they don't like what a program officer has said. They'll go to the vice president for grants. then they'll go to me, and then they'll go to a board member, and we're very aligned in the way that we work. And the board has expressed its desire not to be involved. They've set forth the parameters, the policies, the framework, and they approve all grants, but our board members do not want to be contacted, and in fact will decline to speak with you if you try to reach out to them. And I try to do the same so that we are speaking with one voice, and we haven't had the problem of rogue people out there doing the wrong thing.
Because you always hear fundraising consultants always talk about this, about listen, we know people on the board, and
that won't work.
So that's so good that you guys are able to do that, right?
That won't, and that was actually our board said, will you help us develop a policy that keeps us from being in the middle of this? They hired us. They want a professional staff to follow their guidelines and then present grant opportunities to them. They don't want to be in the middle of it, and they don't want to be lobbied.
We often hear from foundations that they really love the idea of nonprofits collaborating, right? That's sort of a big deal. Kenyatta wants to know if you guys indeed partner with other organizations as well, other foundations to do stuff.
Yes. In fact, the 5 of us in Houston who do a lot of health work have our own collaborative and co-funding platforms.
Who are the 5?
Us, Endowment, Simmons, Rockwell, and Cullen. And it's not that we fund in lockstep, but it's that we work together and have regular meetings. We, in addition to making some funding decisions, if not in lockstep, in collaboration with each other. I mean, sometimes it's intentionally, you do that, we'll do this. And sometimes it's, why don't we all pile on and do this because it's really important. But we've also together are conducting a lot of research on some of the nonprofits that we work with so that we have a shared set of data about them. This has to do with community clinics. We've also partnered with foundations nationally. One of the things that I really want to do is bring more national foundation money into Texas. And a way to do that is to co-fund and to approach some of these and say, they don't have to pay us any money. We pay our own way. But we just did this with the Packard Foundation, who does a lot of work around children's access to care. And right now they are funding in 5 states around early childhood interventions, and there was a group from Texas that wanted to participate, and they were only able to take 5 states, and Texas didn't make the list. And so we said, okay, we'll pick up the Texas piece. And so we are paying the way for the 3 Texas groups to participate in a national cohort with the other 5 states. They are able to get technical assistance at a level that we could not have afforded by ourselves. So we're paying 1/6 of the cost of this, and our Texas folks are getting the advantage of working with 5 other states, all funded by Packard.
Wow, that's fantastic.
So
and a lot of those national partnerships just do wonderful things. It's sort of an interesting.
They do, and so I'm now on the board of Grant Makers in Health, which is the largest umbrella organization for funders in the health space, and it is just one giant networking opportunity.
Wow.
And philanthropy is very collaborative because we're not fighting for money. We've got our money, and so we're not fighting for money.
It's easier on you guys. But I find nonprofits, even when you're fighting for money, by and large, most nonprofits are eager to collaborate. I mean, they all know who's the person who doesn't play well with others, but mostly people collaborate, which is sort of nice. Francisco Aldana wants to know, do you ever find organizations where there's sort of a lack of transparency, or you find misusage of funds, and how do you deal with that?
We haven't had an example of that yet, so we're less than a year into having actually written a check to anyone. But we have some processes and policies in place for if we ever get wind of anything, whether it's by a whistleblower or some however we may learn of it. It hasn't happened. We get audited financials from anybody that's got them, and a lot of the grantees we fund have audited financials. Not that you can't have audited financials and still a lot of fraud. And we keep our ears to the ground. Our program officers are out in the community a lot, and we just kind of pay attention to what's going on, and hopefully if something like that is going on, we will learn about it. We require grantees to let us know if there is any senior management change, which is not always a bad thing. It's just a fact, and we want to know about it because we think the leadership is the key to whether our funds will be used properly or not.
You know, you hear this, I hear this from a lot of foundations all the time, that leadership. Does the rest of the world get that as much with nonprofits, do you think? I mean, because for a foundation, it seems very important. I wonder, do boards get that as much?
I don't know. I don't know. I mean, there's a real unevenness in nonprofit boards. Like I was saying before, and it's not because the people aren't, the board members aren't competent. I don't know, sometimes they just have a different view of what counts when it's a nonprofit.
Because I'll sometimes see a nonprofit that I think should be very high functioning, but they don't have a great leader. And I may be buddies with the leader, but I know they're not a great leader. And I see that the board doesn't seem to get that whole thing.
Yeah, well, one of the things that we're hoping to do through this capacity building person is identify if it's a great organization with real potential and some weak leadership. Do we bring in, leadership training? And I don't mean classes, but, should we pay for executive coaching? What are the things that we can do to shore up that organization?
Yeah.
If they're willing to take it.
Right.
And if they're not, then that gives us a signal. And
you don't have to give money.
Well, right. And
Moises Fabella wants to know, how do you guys measure performance? Do you guys use metrics? How do you look at impact?
So that is a fantastic question. So we are, for ourselves, we are about halfway through the development of a strategic evaluation system based on the model that FSG, who I know you know, has developed. And ours has 3 components to it. The first is about stewardship, and it's really just metrics about what we have done. It's not evaluative at all. There's no judgment attached to it. It looks at where we funded, what we funded, that sort of thing. Then we've got another module in there that we call investment impact, and that is where we look at, each of our grants has metrics attached to it, and so we have some evaluation component in each grant. Now, some are not robust, some are actually not robust at all. Some are extremely robust where we're paying tens of thousands of dollars for external evaluators. But what we will do in this second module is look at the evaluation and the impact of each one, but we also want to bundle them together. And because what we're interested in is what is the impact we are creating as an organization, and not just with the grants. We have research products, we have convenings that we sponsor, and we have work with congregations that we do, and all of that is subject to evaluation, different metrics obviously for different things. And then our third evaluation module has to do with pathways to transformation, and in that module what we are going to be looking at really are transformation indicators at the community level, which we would not be able to claim attribution for. But are we seeing in the communities where we work movement in the right direction toward the indicators of a healthy community, where we feel like we have contributed to it?
Wow. Jordan Klein wants to know, in brief, what's the best and worst part of your job?
The best part of my job is getting to meet really different people in different parts of these 57 counties who are passionate and committed and interested in just changing the world, and that's so inspiring. And the worst part of my job, it's not having to say no. That's really not I'm having to say no. It's, I guess some of the administrative matters. You know, I came to the job because I love the substance,
Yeah.
but I am managing
Yeah.
an organization and some of the management
You'd much prefer to be
challenges.
looking at the big picture than trying to deal with little.
Yes, I'm here for the mission. I can't deliver the mission if I don't manage the organization, but I'm here for the mission.
Yeah. So a few sort of fun questions to finish us up. Your favorite restaurant in Houston?
Well, that depends on when you're asking. So you're asking today.
And you can give multiple answers. Believe me, this class is anxious to find ideas for restaurants.
Okay, so I'm thinking Caracol
Oh, wow.
because I really
I was just there Friday for lunch. It's so fantastic.
isn't it good?
Yeah. You ever get that little dessert where the little chocolate ball that you have the little hammer and you open it up and it's all this coconut cream?
No, I've never gotten a dessert there. By the time dessert rolls around, I can't
Elena,
eat
it's so
anymore.
fantastic. But of course, dessert is a weakness. But anyway.
I really like the broiler burger in Bel Air, which
yeah.
I'm sure,
You must live
know,
near
as a
there,
health
right?
person, I'm not supposed to be saying, but you know, all things in moderation. I like some of the food carts, and I don't know
Oh,
the
yeah?
names, but I just like the idea of the food carts, and it feels fun to participate in that because it feels like
And they're all very healthy,
public,
right? All
yeah,
those-
every one of them,
Yeah.
a public and civic act.
Yeah. Is there a place in Houston that's sort of a secret place that not enough people know about that you particularly like?
I feel like everywhere I go is crowded, so there must not be. there must not be. Do you know a place like that
Well,
that I should be
I
going?
often like. I live on Cherryhurst Park. I always think Cherryhurst Park is sort of like a little secret place. But I think I like though the Mandel Park around the Manil. So, but I've been going there for picnics for years. And the last time I went, it was a complete scene. It's like it's not, you know, like people
You
doing
said it too many times.
tightrope walking there and juggling. It was like Saturday in the park. It was just
Like a real city.
Yeah, exactly. It was nice. When you were a teenager, what did you want to be when you grew up?
A writer,
Yeah.
yeah, fiction,
And do you write at all now?
not fiction.
No, not fiction. Just
And
like
actually,
real
I don't
stuff.
get to write enough now. One of the things that I wish I could do more of is writing because I really enjoy it.
Wow. Well, thank you for all the work that you do. Thank you for being here with the class
Thank
and
you for
talking with us.
inviting me.
Absolutely. You do such wonderful stuff, so thank you. Hey, guys, thank you. Another great night, another great guest with Elena Marks, and we will see you next time here in the Leadership Studio.